Good afternoon and thanks for joining us. I'm Judy Simpson. Our focus today is on the Binter Center at the University of Vermont Medical Center. The center is formally known as the Binter Center for Parkinson's disease and movement disorders. As part of today's program, we're going to meet a couple from Burlington who are coping with the movement disorder known as Huntington's disease. But first, I want to introduce the director of the Binter Clinic. It's a pleasure to welcome Dr. James Boyd. Dr. Boyd is a neurologist with the UVM Medical Center and a professor in the College of Medicine. Thanks so much for coming in.
Yeah, thanks for having me.
What is the Binter Center?
So the Binter Center was formed through a philanthropic support of a family of Nancy Binter and Bela Radkovitz. They approached the University of Vermont Medical Center and made a very substantial donation to support the development of a comprehensive center for treatment of movement disorders, so Parkinson's disease and related conditions, Huntington's disease, which we'll talk about today, being one of those.
Mm-hmm. How common is Huntington's disease?
It is considered a relatively rare condition. The estimate is about 30,000 people in the United States who are known to have the condition, and they estimate roughly about 200,000 people who are at risk. And when I say at risk, it's a genetic condition, so people may carry the gene but may not know that they carry it or that they are at risk of having it in the future.
Talk a little bit about that as far as it being an inherited disease.
So it's associated with a single gene. Many hereditary conditions have multiple types of genes that can cause them. This one has one particular gene. If it does run in the family, if you get the gene testing done, you can know with certainty whether or not you will have that condition during a normal life expectancy. So it's a single gene that can be tested.
Mm-hmm. And is it like 50% if you test positive?
Correct. So it's what's called a dominantly inherited gene. So if your parent has it, you have a 50% risk of getting it. The same for your siblings, and a 50% risk of passing it on to offspring.
How many people opt to have that testing done? Because I would think there'd be a fair number of people who'd say, I don't want to know.
There are many people who decide they do not want to have it done. There has been a trend in the recent years toward testing, but absolutely some people just decide that they do not want to know the results. The most common situation that someone gets testing done is if they're in a situation of family planning. They're deciding to have children. They want to know whether or not they are at risk of passing it on before they do so. The same holds true that there are opportunities for bearing children without passing on the gene through in vitro fertilization. So an offspring can be tested prior to implantation. So that's been a trend as well. We've seen a few cases of that.
And as always, when you talk about your center, it's multidiscipline as far as when someone decides that they may want to be tested. It's just not you and your doctor.
Absolutely, yeah. I think it's a complicated decision to decide to get tested, and the recommendations from the Huntington's Disease Society of America are that you do have a comprehensive approach, that you have the person who is considering this have a support person who's identified. They meet with a genetic counselor to talk about what genetic testing entails and what those results may show. We have a counselor who is a social worker who works in our Huntington Center who also meets with them, and then myself. So it is a three-person visit before one comes to a conclusion that they will have testing. And about 50% of people who go through that clinic come out and decide that they want to get tested. About 50% will defer and decide maybe they'll do it in the future.
All right. Well, one of your patients from Burlington is living with Huntington's disease. Her name is Lynn Matthews. Because of her Huntington's disease, Lynn is largely unable to speak, but she is very much aware of her diagnosis, and she works hard mentally and physically to cope with the disease. Lynn draws on the support of her family, her medical providers like Dr. Boyd, and many others, including her wife, Els Curtis. Across the Fence spoke with Lynn and Els about the disease and what the couple wants others to know.
Sometimes we do just look at each other and say, this disease really sucks. I mean, I'm not trying to sugarcoat anything, and I think if I'm not putting words in your mouth to say, yeah, this really is bad. The big thing that happens when people get their diagnosis is, rightly, they're devastated. And they tend to self-isolate. Some families will exclude a person with Huntington's, but neither of those is necessary. There's so much available now that if you work together as a team, you will be able to have good quality of life for quite a while. Lynn's family were dealing with it before I knew them, and they had made a commitment to stick together. to love and support her no matter what was happening.
Has connecting with other people or other families with Huntington's disease been important to you? Has it helped you in some way?
It has helped me a lot. And it must have helped her because she did it for years before I even knew her. She was very early and instrumental in setting up the Huntington support group up here. And she took me to it as one of the first things we did when we were getting serious. And a lot of times we're just swapping practical advice, moral support, obviously, grief sometimes. But a lot of times it's just nice to be with people that you don't have to explain what it is and how. You can talk about how things are going without doing a whole background on the disease.
What's helped you as individuals and as a couple to face the challenges of Huntington's disease?
Obviously, loving each other. But the other thing was, as she made me aware of the role that women's teamwork had played in her life, and I realized, well, you know, we really are going to be, this is a physical endeavor, we're a team of women, and it's just another athletic team sport for women. And that's how we like to think of it. And we definitely we understand her as an athlete. She does her exercises, she works at her transfers, she works at any of her PT, she works very hard on any PT she's assigned. And these are things that mean that she is still the athlete that she always was. And so that continuity of her identity, I mean, and she's a lot of other things besides that. Lynn, is that, would you say?
Yes, I do.
And then the other thing is how much it just means to be at home. She has her Caldwell, New Jersey blanket. She's only ever lived in 2 homes. It's a very deep word for her.
Now, flick, stand, bend, beautiful, beautiful.
To be able to be here, this house is like her skin. And so it does mean that her body is in one piece when she's in her house.
Lynn, home is important.
Right.
What resources have allowed Lynn to stay at home?
Well, number one is definitely the way the medical community has worked together. Her primary care is at the community health center. She has a phenomenal dentist up at Willard Street. When her career was very difficult, that hygienist was still on the job with her. UVM Medical has taken care of every little thing. They never said, oh, you've got Huntington's, we don't need to do this or that little regular thing you have to do with other health issues. You know, the skin, the thyroid, the mammograms, they treat her like a well person, the well person they want her to be.
You've been part of research?
There's a couple of things.
Yes.
A couple of things that happened. We were in Vermont in research for a couple of years.
For the cohort study. She took part, there was a huge program called the cohort study where they simply, everybody with a diagnosis that was willing, she would go, we made the drive down to Albany, she did the drive to Albany, and they would just measure all this stuff and just keep a year-by-year chart of how each patient was progressing. And the main thing they learned was that it's a unique disease for every person, and you get a diagnosis, it is not a script. It's going to be different for every single person, and for each person it's going to be different, sometimes even hour to hour. So the cohort study was very valuable and is very valuable in changing the stereotype within the community. Wouldn't you say that, Lynn?
Right.
Lynn is very, very strong at making the management happen. I mean, that's her understanding of what she's doing. We're giving her stuff so she can manage her life. Your quality of life is not about whether you can walk or even talk. It's about the other stuff. People know that, But sometimes it's hard to believe that you're still going to have access to it when you have something as devastating as Huntington's. I want, no matter what people are living with, I want them to understand that they can have quality of life, but you have to fight like hell to keep your resources in line.
Well, our thanks to Lynn and Els for taking the time to speak with us. They hope that others involved with Huntington's disease will draw strength and inspiration from hearing their story. My guest is Dr. James Boyd. He's the director of the Binter Center at UVM Medical Center. We should mention that, I mean, there are treatments and supports.
Absolutely. So part of taking care of a progressive condition like this is understanding what's in store and what type of symptoms you can experience. Additionally, there are many treatments for the different symptoms that can go along with Huntington's. So I separate the different types of symptoms into three categories of movement, meaning extra movements, or what we call chorea, with twitching or involuntary movements which occur. We have many medicines that can reduce those symptoms to make your day much easier. Mm-hmm. In addition, there are some behavior or personality or psychiatric symptoms that can occur: depression, anxiety, sleep conditions, irritability, aggressiveness, and all of those are amenable to medications which can help to make someone's day much easier.
Mm-hmm. And then also to, you know, supports like certain equipment and that kind of thing.
Absolutely, and we do at the Binter Center. One of the goals is to take a very comprehensive approach where we integrate services of therapies such as PT, OT, speech and language. We have a multidisciplinary clinic where someone can come in and see all of our services on a single day, to allow it to be easier on them in terms of travel, and also giving them a more complete picture of what's necessary, both medication and non-medication approaches. And additionally, just partnering with community services as well to make sure that people know what's available near home.
Mm-hmm. And the center's also a center of excellence, we should mention.
That's right. We were fortunate to get a Center of Excellence designation from the Huntington's Disease Society of America, which was really an honor and was a testament to the fact that we do create this comprehensive approach.
Mm-hmm. You know, people might be out there watching and say, well, I have an aunt or an uncle who has Parkinson's disease or Huntington's disease. What should I do?
Yeah, I think the first step is really getting a referral to the center. The entry point is to see one of our neurologists, and from there, we decide what are the appropriate or necessary steps in terms of care for them.
Mm-hmm. What current or upcoming research provides promise?
So we have a few different research programs which we're conducting here at UVM. One is for a newly developed symptom treatment, so a new treatment to reduce extra movements. That study is completed or completing and is a drug which is with the FDA currently, so we're hopeful that will get passed by the FDA, and we'll have a new medicine for controlling movements which is better tolerated than some of the older ones. Mm-hmm. We also have, there was mention of what was called the cohort study. That study has been dovetailed into a newer study called the Enroll HD study. It's what we call a cohort study, where we follow people over time, comparing them to their family members who don't carry the gene, people who carry the gene who don't have symptoms yet, and we're following an infinite number of people over time to see what the condition causes, how is that differing from community controls or people in the family who don't have it. We're looking to enroll as many people with Huntington's in the community here as possible, as well as their family members. It's a study which is being conducted all over the world, so they're looking to put tens of thousands of people into that study. And lastly, we're doing a disease-modifying study in which we're looking at a potential treatment which will reduce the inflammation which occurs in the brain in Huntington. So it's associated with that gene that I talked about earlier that produces an excessive amount of a particular protein which aggregates or builds up in the brain, and then the brain has a low level of inflammation that occurs as a response to that protein, which causes some injury to the brain and causes the symptoms that are seen in Huntington's. The treatment that we're looking at is to look at a treatment with an antibody which reduces the ability for that inflammation to occur, and is hopeful that will provide something that will slow or reduce the progression of the disease.
I would think that would be a huge improvement if you could just slow down what's happening. But as you mentioned earlier, it's an individual case-by-case basis.
Absolutely, yeah. And I think what we're always uncertain of is how the condition will unfold for one person versus the other. We know that it does progress over time. Which of those symptoms I mentioned earlier in terms of cognitive trouble or movement trouble or changes in personality or behavior is different for everyone. All
right, well, for more information on the UVM Binter Center for Parkinson's Disease and Movement Disorder, you can check out the website on your screen. It's uvmhealth.org, or you can call 802-847-4589. Thank you so much for joining us today.
Thank you for having me.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.